This podcast is for educational and entertainment purposes only and should not be considered medical advice.
Welcome to Table Rounds. We're here today. We roll with the Med Academy, lighting the way. Table Rounds, Table Rounds, Table Rounds. Your voice, your guide. Together with knowledge, we stand side by.
Breast cancer is the most common cancer in women. About 1 in 8 women in the U.S. will be diagnosed in their lifetime, but the impact is not the same for everyone. Black women are about 40% more likely to die from breast cancer than white women, and are often diagnosed younger and with more aggressive disease.
There it is again. That humming, almost like it's coming from inside me. No lump, no pain, but something feels off.
Early detection and timely care can save lives, especially in the Black community, where women are more likely to be diagnosed younger and face higher death rates from breast cancer. We deserve to catch cancer early, treat it early, and survive it. Please don't wait. Schedule your screening, listen to your body, and make your health a priority.
I'm sorry, Dr. Johnson. You have breast cancer. We caught it early and we can treat it. Good thing you did your mammogram. We would be having a different conversation if you waited.
Early, that word means everything. I'm scared, but I'm relieved we caught it when we did.
Join us at Health Pro X to learn more about breast cancer and other important health topics.
Thank you for listening, and please subscribe to our YouTube channel. Your support helps us spread life-saving information and empower our community.
Welcome back to episode 4 of Table Rounds. I'm Dr. Princess Dennar, a board-certified internist and pediatrician, and I have with me today my dear friend and co-host, Dr. Darlonda Harris.
Hi everyone, I'm Dr. Harris. I'm also a board-certified internal medicine and pediatrics physician, as well as board-certified in obesity medicine.
And today's topic is beating breast cancer from discovery to recovery. We're diving into this journey that touches millions of lives from the moment of diagnosis to the final step of recovery. We're going to walk through what happens after diagnosis, understanding the different stages, treatment options, and managing side effects, and eventually moving into recovery. And even beyond medicine, we're going to explore the human side of the journey, the emotions, the community, the support, and the strength that comes from empowerment through education.
And today we're honored to be joined by Dr. Tammy Singleton, a world-renowned hematologist and oncologist. She is also the Chief Science Officer of the American Hemostasis and Thrombosis Network, as well as the co-director of Hemostasis and Thrombosis Network at Ochsner Clinic Foundation. She will be sharing her deeply personal journey from the shock of diagnosis to the balance of both being a healer as well as a patient. Her story is a powerful reminder that behind every white coat is a human story of courage, compassion, and triumph. Welcome, Dr. Singleton.
It is a pleasure to be here in this highly esteemed company. I'm so excited.
Thank you so much. And so we'll just get started. So take us back to when you were first diagnosed. Tell us about that moment.
Absolutely. I'll actually start maybe just a couple of months before that, because I never missed my annual mammogram. I have had it since I was 40. I'm now over 50. I would have it every year, sort of like clockwork. To add this additional information, I had really dense breast tissue, and at one point I was having MRIs. I was followed up by the kind of higher risk team, but they were like, listen, we don't see any concerns here. I stopped having diagnostic mammograms, which I would joke to myself and go, yeah, today's not a good day for me to find that I have breast cancer, so I'm going to reschedule that. And I would I would reschedule it to the next month. I was like, okay, I know, just in case. I was like, nah, today's not a good day.
Right.
And so I had a joke with myself, and I would always reschedule my mammogram like 2 or 3 times. But I would always end up having it done like within about a couple of months of it being scheduled. So I never missed it. And a couple of months before I was scheduled to go, I was probably on my second reschedule. I was like, okay, this is tradition. You're on your second reschedule. And I was in the tub or shower, and I felt this buzzing, like a humming or something. And I thought it was a little odd, right? and it was like a vibration, sort of. And it was in the affected breast. And I said to myself, I said, well, if it is anything, I'm scheduled, right, for my mammogram. So I'm just gonna, we have to compartmentalize, right? So I said, okay, let me wall that off, unless I have work to do. Let's just keep, keep it moving. I'm going to get this mammogram. So I scheduled a mammogram. So from people from New Orleans, about Jazz Fest. So I finally said, okay, I'm going to go. I always go to Jazz Fest the first day. So I'm going to go the morning of Jazz Fest. I'm going to go. I was like, I'm going to go at 7 in the morning. I'm going to get this done. So nothing's going to interfere with it. I'm going to go and have my cup of coffee. I'll have breakfast, and then I'll float myself on over to Jazz Fest. So I go and I have the mammogram, and, the technician repositioned me one time too many. Like she, they always say, oh, I just want to get a better view. And she was so professional. Like she was really good. I'd had her once before, and she kept repositioning me. And to make this long story short, I knew that there was sort of something there. So on the way out, I kind of turned and looked at the mammogram, and stood there for a minute. And I was like, there's something on that mammogram. But once again, I compartmentalized. I said, nobody's officially told me I have breast cancer.
Right.
I did see something, but I'm not a radiologist. I'm like, going through this myself. So they, of course, call me and tell me my mammogram's abnormal. Asked me to come back in for the diagnostic study. So I have the diagnostic mammogram followed by the ultrasound. Well, that's when the gloves were really off, right? I mean, I do ultrasounds. I'm like, I can read ultrasounds. So it was sitting there nice and pretty.
Wow.
I never told anyone, Oxnard is a big place, and I was there. I never told anyone. I'm on the pediatric side. It's a big place. They don't know me.
Right.
I never told anyone who I was. I just sat there watching her, measure it.
Wow.
And I was like, how about that? And when she said, I'll be back. And I said, sure you will.
Wow.
I took a picture. I just took a picture, and I sent it to a dear friend who's a breast surgeon. And I would show her things, with the patient's permission from time to time. Like, I want to, send you in. She was like, oh, that looks like a nice low grade malignancy. And I was like, it sure does. And then she said, wait a minute, who does this belong to? Because I sent it to her with no story.
No story, no picture, no names.
I didn't show it. Of course, no name, no identifying factors. And I didn't tell her. Usually I'll say, I have a 25-year-old female. I'm concerned about blah, blah, blah. But this came with nothing. And she was at her daughter's graduation. I didn't want to, I said, oh, just the patient. So the doctor comes in, and he was very kind and very professional. He sat down. He grabbed my hand. He said, this really looks like something, but we won't know. And I said, look, I can't take it anymore. I'm an oncologist, and I see what that is. I was like, I know that we have to get tissue, but it doesn't look like anything else. I was like, look at the borders, like on that.
Yeah.
Like, I'm like, that's a tumor.
Yeah.
And I was like, this is shocking, but I'm going to be okay. And he was very compassionate. He treated me then like both a patient and a colleague, which I really appreciated.
Oh, that's nice.
And he was very compassionate. He still went through the steps. He offered me even his cell phone number. He's like, look, if you want to talk. And that meant the world to me. Like, for him to, again, take that collegial step, right, with me. I went back in for the biopsy, and me compartmentalizing, right? I was like, I have work to do. I want to schedule this I don't want to schedule this before my child's graduation. This is now May. And I said, okay, let's do it after my child's graduation. I go in the Monday after. I have the biopsy. The results came back, and, before I opened it, I was like, trying to get my mind right. And it was not triple negative. So it's like I was going through it methodically, like a clinic, like a clinician, right? Like that was the first thing I looked at. I said, okay, this is a malignancy, like we know. And I went, it's not triple negative. And I went, okay, at least I know that means I'm not automatically going straight to, chemo. Yep. And then I looked again and I said, okay, it's HER2 negative, progesterone, estrogen positive. I looked at the size. I'm now
Right.
going through all the steps, right?
Hmm.
Of course, they don't see any nodes on the ultrasound, so there was no nodes they could see at the time.
Mm-hmm.
Again, the clinician in me just kind of kicked in.
And it's not even just a clinician in you, right? Because you're also, and you said it, but I don't know all of our viewers know what that is. You're an oncologist, so you are a cancer doctor.
Yes,
Like you treat cancer, right? And
I'm a
here
I'm
it
a
is, you're
cancer.
diagnosed
Yes,
with this.
that's
Yes.
right. I'm a cancer
Mm-hmm.
doctor. So
Mm-hmm.
although I'm not a breast cancer doctor, I'm a
Correct.
cancer doctor.
Correct.
So it was probably honestly maybe a little bit of a defense mechanism. You know, I kind of immediately clicked into that kind of clinician for myself. I didn't feel the immediate devastation, of it. It was almost like a blunted response. Like I was probably stunned
Mm-hmm. Mm-hmm.
more than anything. And immediately I had some travel to do. I had some meetings to go to, and I was going to do a lot of travel over those 2 weeks. And you know
Yeah.
what? I just said, I don't really want to talk to anybody.
Mm.
I'm going to take this opportunity to go away. I'm going to go on my trips and give my lectures and attend my meetings. One was in Miami, one was in California. And I said, you know what? I'm going to walk on the beach and pray
Yeah.
and, just try to wrap my head around just what's going to come next. I didn't necessarily know. I had a conversation with my very dear friend who's an amazing breast surgeon. I just so happen to think, I think everyone should think that she's probably the best breast surgeon in the city of New Orleans,
Mm-hmm.
if not in the region or the state. Her name is Dr. Shawn McKinney. And I'm talking to her and I say, we're talking. And at some point in the conversation, I said, can you operate on me?
Hmm.
And she was like, can I operate on you? She's like,
Mm.
are you kidding? She's like, what friend do you have who compartmentalizes better than me? And I went,
Of course, right?
I was like this. Yeah, you know what? You're really right about that. And so I can't tell you, it was almost like it was a God's gift to me because at that point, whatever fear I was inclined to have,
Hmm.
just knowing that she kind of had my back, it
It took care of it.
went away. And probably always doing things for other people. I don't ever mind doing things for other
Right.
people, right? Helping somebody's family member. I literally, it's never an imposition. If somebody called to ask me my opinion or to do I literally never mind. I'm never annoyed. And I felt like that was returned to me in kind.
Hmm.
You know what I mean?
Yeah.
Dr. I didn't set up an appointment. I didn't do anything. Somebody just called me and said, Dr. Singleton, your MRI is Monday. Your appointment with Dr. McKinney is Tuesday.
Yeah.
Your blood work is next week.
Excellent.
And I call someone else, again, from a collegial standpoint, the people I really respect, like the smartest people I know in different areas. And I called up Ellie Zachris, who I just think is a phenom. She's a radiation oncologist here in the city. I think we're really blessed to have her.
Mm-hmm.
And I just called her to talk through things. And she helped to kind of guide me. I already thought in my head who I wanted my oncologist to be.
Right.
And actually, it was my very first attending physician in HEMOC when I was a medical student.
Wow.
He was a brand new young attending, kind of fresh out of fellowship at the time, Dr. Chris Theodosius.
Mm-hmm.
And I just knew like his training is like second to none. He was so methodical. He was going to give it to me straight. At the time, we didn't know for sure if I was going to need chemo or not because although I was not triple negative, there's now the OncoScore that matters from the tissue. And that's when it just all, I think I probably cried for 4 or 5 hours,
Wow.
after that.
Wow.
And I probably needed to,
Mm-hmm.
honestly. I just needed to. And I just said, I have a lot of hair. I said, I have a lot of hair. I said, I'm going to lose my hair.
Mm-hmm.
I'm going to lose my cognition. I need my brain,
I need my brain.
right? I need my brain to do my job. It's who I am. I went through everything. I was like, I'm going to be crazy. Oh, blah, blah, blah. Like, I went through all the things.
Right.
And it was in that time, in that moment, it was the scariest of times. And there were two things that really helped me. Again, the human part of it. I told myself a long time ago, I can feel sorry for myself between 8 and 8:30 in the morning. And at 8:31, I had to stop. You may have heard me say this, Dr. Harris. I was like, at 8:31, it's over.
Right.
And I could start over tomorrow, but for today, we're done. I was like between 8 and 8:30, right? At that time, Dr. Dennar, by the way, it timed with me dropping the children off, usually for drop off. And the time it would take me to drive over to Tulane. And I could cry all the way to work, be frustrated, feel sorry for myself, say how horrible I was, all the things. And then literally I would look at the clock and I would go, okay, well, that's over.
Back on the
I'm
move.
gonna get it together.
Back on the move.
Back on the move. So, I allowed myself, I said, if I really feel like I need to fall apart like that, I'm not gonna stop it. But I'm gonna try to allow myself to feel it, but not just sit in it like all the time. And I'm a faithful person. And, I told my therapist, I said, and I'm now about to get real intimate. I'm gonna tell you what I said. I said, my expectation is that it wasn't more than 2 centimeters. So my expectation is this is technically stage 1. And my expectation is that I'm going to survive this. And I'm not going to have any life-threatening complications, and I'm going to be okay.